not-for-profit organization working towards preventing needless blindness and vision impairment. And if you see, we do from screening nunchi complex disease varaku manam ikkada treatment chestamu. You can see a pyramidal model where we give appropriate treatment which is available and affordable and accessible. Even patients remote areas lo unna kuda patients ki accessible untundi mana treatment. Center of excellence kanipistundi kada, that is where this campus is located. Along with that, if you see this graph, we have currently these many centers. The total number of centers is 264. It's a pyramidal model. Ikkada tertiary untadi, center of excellence, secondary center and primary center. I just wanted to give children's eye care lo manam em chestunamani. It's been 25 years of children's eye care at LVPEI Institute. We try to cater to all types of children's eye diseases. In the whole network, we see around 300 to 450 children per day. I'm not showing only in Hyderabad, in the whole for eye disorders. So that is 350 to 400 patients we see regularly, and we do around 50 children's eye surgeries per day across our network, be it in other campuses, be it here. Together we do so much, and we do take care of everything related to children's eye care. It's a comprehensive health management for children's eye problems, from preservation and restoration of sight to prevention and treatment of blindness. When I say preservation and restoration, simple pair of glasses iste manam myopia treatment cheyochu, or other glasses problem manam treatment cheyochu. So simple disease, and if you want to prevent some of the diseases, we have this kind of thing. It's again from comprehensive eye health from across the network. So this is what we are at currently. We have 4 children's eye care center, one in Hyderabad, Bhubaneswar, Vijayawada and Visakhapatnam. What you can see here in blue is the myopia centers. We have 2 centers purely dedicated to myopia, what we are talking about today. So they take care of, you are asking about the numbers of how many we see per day. If you see across the network, we see around 50 to 75 children with refractive error. Out of that, around 40 to 50 patients per day will be myopia or myopia related diseases per day. We will be seeing it. So that's about this. So myopia, it's other pandemic. We used to think COVID is a pandemic, but this is also other pandemic which is rapidly rising. By 2050, 50% of the world's population, especially children, will have some amount of myopia. That's the prediction model what we have over a period of time. That's why it is called also as a other pandemic. Why it is important, why this burden is there? Because people are more and more into screen time, urbanization, spending less time in sunlight. Children are not playing outdoors, they are usually indoors. What we need to change the scenario, like children always emulate adults. If they are using cell phone, these people also, children also try to emulate the same thing. So we need to change the whole scenario, especially during the last COVID pandemic. Most of the children were indoors. They were doing a lot of work in terms of their classes. Everything was on the screen. So screen time is really on the rise. So we have formulated some kind of slogans so that the children will get less and less myopia. So the whole thing here is do less and less computer or mobile or TVs, screen should be less, all electronic things, and they have to spend more time green. And this is the kind of recommendation we had done during the COVID time. But one of the simple thing is, take a break every 20 minutes. Whether you're reading or doing some kind of homework or some screen time, every 20 minutes, take a 20 seconds break and look at an object 20 feet away. So that this can relax your eyes and the eye is not always focusing on some object. So that makes the eyes better. But just I wanted to give, after that Dr. Pawan, who heads the Infer Myopia Center, he will talk a little bit about the numbers and the research, what you are asking about. This is what we do. Because if the power keeps on, when a child comes with they are -1 at 3 years, it can go to -2, -3, -4, -5. Some kind of, it's unpredictable. So what do you do? Can we arrest this progression? We have a base up approach where we do a lot of tests in terms of technical things like looking at the length of the eyeball. This myopia center just does that. Whatever 15 to 20 children we see per day, we do all this evaluation and we give a base up model where avoid screen time, increase outdoor activities. There are some glasses, obviously we have to give glasses. There are some eye drops which can control this growth of the myopia. So there are some special glasses we can give. Dr. Pawan will talk about it. These are the special glasses we can give in some of the patients where we can stop this. There are some kind of contact lenses we can give so that their power from -2 to -8, it might stop at -4. That's what we are trying to do through this, myopia thing. And we want more and more parents to understand how can we prevent the development of myopia. The base, you can see, if they have more outdoor activities, all that, the development of myopia itself can be stopped. If they develop some kind of myopia, you can see this base up approach where we can do some kind of intervention, contact lens kani, eye drops kani, special spectacles kani pedte, the power growth will not be there. But most important, I would say, sunlight. The naturopathy or natural therapy is much better for the prevention aspect. So focus more on sunlight, and we have some kind of combination therapy. I don't want to go into the details. So this is the overall approach what we take for myopia. So now I request Pawan to talk about a little bit more about the research and also innovation what we are doing in this area. Thank you.
Yeah.